I don't think I have to be preaching and telling you what I think. I'm more interested in listening to it today.
I want to give you a little bit of history, my history. I have epilepsy. So for years, I could not get insurance. And that's a very difficult situation. I was able to get catastrophic insurance, which I paid and paid and paid. They didn't pay much out.
Son, he's 25. I've already actually written to you about him. He was recently diagnosed with a very serious cancer, and he will go off of my health insurance in this December. And so I have serious concerns about the health care legislation that this Congress is currently working on. Metaphorically, there seems to be a rush to do surgery before the workup is complete. There is no emergency.
2010, over 10 million Medicare recipients saved over $20 billion on prescription medications. My husband and I saved $3,000 last year on our medications because the ACA provided resources to close the donut hole. If you're not familiar with the donut hole, that's the coverage gap where when you reach a limit, you pay full price for prescription drugs. Okay, I'm retired, my husband's retired. Where do we get that extra money if the ACA is going to be repealed and Trump Care is not going to replace that? So I'm asking, what's happening with the donut hole? I've not really heard. What is the plan there?
We're not gonna, there's lots of things we're not changing, and we're not touching the donut hole.
Yeah, I thought you might say that. So what I thought I would ask is, where do you stand on privatizing Medicare? Because that is the next step once you apparently have dealt with getting insurance, medical insurance away from the poor, from the working poor, and the lower middle class. Where do you stand on privatizing Medicare, please?
Sure. Thank you. Right. Yeah, I don't think I'm interested in privatizing Medicare at all. I'm interested in giving people choices, and if they want to manage their Medicare more or do things more like the Advantage Medicare, I'm okay with that, but there's no intention to privatize it as you describe it.
Have you listened to Paul Ryan? There are plans. Do you know that in the state of Kansas, we already are set up to block grant Medicare and Medicaid?
Yes.
Yeah.
No, I don't think it's thinking about block granting Medicare at all.
Oh, yes, it is.
Yes.
No, I'm not seeing
Follow
that.
what the governor has done.
Okay, but that has to do with Medicaid.
Medicaid and Medicare.
Farming for close to 30 years, buying my own health insurance the entire time, and I noticed your sign and your poll that's sent out. Do you want to know how many times in that 30 years before the Affordable Care Act my health care cost did not increase?
0?
Yeah.
So I believe that your sign is perhaps misleading and distortive, and I wonder if my comments, which I've given a letter to your staff for, is for working poor. So, if, and I have the numbers in there, so I will save all of you from the details. A widow working 40-hour week, full-time, $9.50 an hour is $16.50 a month income. She lives in a trailer in the mobile home park. The trailer has a 7-year lease on a $900 trailer, which gets her to $375 a month rent. By the time she pays utilities, only $100 utility, because that mobile home she has doesn't use the $200 to $300 a month gas and electric that most of have any of you been in a $900 trailer? Most of them use more than $100, but she, with only $100 there with food, because we want to eliminate SNAP too, with no insurance, with no subsidies for housing. The least expensive health care plan in Kansas for her and her 2 teenage sons is $750 a month. And that's a health savings account plan. I was wondering if you could come up with a budget that she can pay the $750 a month health care plan, pay for her housing, pay for her food, and how long will it take her to fund that plan so that she can go to the doctor the first time.
Yeah.
I think that greatly illustrates the point. Here we are today, and the system's broken. That exactly illustrates it. I wish this had worked. I pray to God that it had worked, but it didn't, unfortunately. And that's why we have to fix it. So what we would do with that person is she would have tax credits to help to pay for
the premium. Where's she getting the money?
So if she wants insurance, we will give her a tax credit to pay the insurance with.
Her tax obligation won't cover the
I
premium.
understand that.
Well,
That's why she gets a tax credit. It's literally the government writing a check to the insurance company to cover that situation. So that's exactly, it's going to work exactly the way it's
How
supposed
does the
to.
government pay for that?
What do you mean how they pay
Well,
for
how
it?
do they, if she doesn't make the money to get a tax credit,
Right?
okay, where does the money come from to cover her?
Literally, it's like almost like it's writing a check to her, but it's
Okay.
going to go directly to the insurance
Right,
company.
and so my question is, where does that come from?
The federal government,
Where does that come?
the taxpayers. What's the trick?
Well, if you guys, did anybody actually read the bill here other than me?
I read it.
Okay.
Good. So, I mean, so where I don't understand your point. I'm sorry.
Well, I'm simply asking where the money comes from for that tax. You say it comes from the government. Well,
It
how does
comes
the
out of our
government
taxes.
get the money? Right now, they have taxes on a higher income person to help pay for this, for the subsidies now. So my question is now, instead of an income way to pay for it, it's an age tax, correct?
It's an income based as
The
well.
older you are, the more you have to pay under
Right,
the
that-
Republican plan now, right? It's a 5-to-1 versus a 3-to-1.
That's what the insurance companies could do if that's what they choose. And that's probably is much more accurate the way it has been. That's what economics would dictate. Okay.
Hospital insurance, this is page, I believe, 88 of the readthebill.gop. Says hospital insurance, in addition to the tax imposed by the preceding subsection, there hereby imposed an income of every individual, a tax equal to 1.45% of the wages. So basically what Dalton and I worked through was the taxing and the math. I had talked to my CPA about it using my 2016 tax returns for my family. My husband is a Navy vet. He has chosen to continue working in the public sector, working for the county of Saline County. We make under $65,000 a year. If this passes the way it is going to increase my family's tax burden by $6,915. That is more than our annual food budget, sir. That is my concern. So, as Dalton and I were going through it, we found some tax things that I would like to make a suggestion, perhaps. The repeal of the net investment income tax. Those sneaky SOBs. You can tell them straight up. If you want to slide this kind of crap past Kansans, don't tell us to read the bill. The repeal of the tanning tax, which is a 10% tax on people who use tanning beds. As a doctor, as a human being, as anybody over the age of 12 knows, tanning beds are bad for you, don't do them. If you're going to continue to use them as people use alcohol, tobacco, firearms, you can pay a sin tax. Suck it up.
I wanted to be sympathetic, so I have a sign that I'm not holding up because perhaps it's better to say it here. The sign says, "Not Huel's camp, prove it." Unfortunately, much of what I've heard you say on the campaign trail is Tim Huel's camp with table manners. And I realize, so I'm being sympathetic here. I understand that what you often hear in Western Kansas, man and woman on the street around the coffee shop, are similar kinds of perspectives. I think we are all pretty bewildered about how to handle this kind of national health care plan. I'm judging by the response in the room, and there are people who are scared shitless about what's going to be coming down. And they want you to oppose it and they want you to give reasonable solutions. That is not easy. Okay, I recognize that. It's very complicated, as Donald Trump now has recognized.
I guess my view is a little bit different than what I'm hearing on some of this, and my wife, who was going to be here, she goes to a doctor who doesn't accept any insurance, no paperwork, no nothing, and it makes the relationship between her and the doctor just her and her doctor. And I guess what I'd like to see is we go back to the relationship with we don't have the government in our business telling what insurance we need and what programs, and I don't have to carry stuff that I don't need. If what I have to do with her is I have to carry insurance for her, and then her doctor, it's worthless. So I'm going a totally different way. Get the government out of it, let it be between me and my doctor. Insurance companies get them out of it unless it's this catastrophic type healthcare insurance. But get it back to where we can do just.
It's clear that ACA has made insurance possible for tens of millions of people who couldn't get it. I know that for me, I'm get my insurance through the market. It's made it possible for me to afford insurance. I'm acutely aware that Americans were told by the president that the replacement would be much better. I take that to mean at least the coverage and more people covered by it. And he insisted that it would be far cheaper. And so if I'm not opposed to replacing ACA, if that's what you do, everything I'm reading now suggests that is not going to happen. And so when you talk about the failures of the ACA, I trust that whatever it is that you're going to undo will be replaced with something that goes further down those roads, increasing coverage, increasing availability, and reducing the cost. I personally don't believe that the president knows what he's talking about when he says that he can provide insurance that costs much less. The United States provides health care at a cost far greater than any other Western country with inferior results.